Happy New Year. We know with the new year comes a lot of resolutions to get fit and to exercise more and to be healthy. All of those are great goals, but it's important to make sure you are exercising safely in order to age well. Join us to find out more about physical therapy and how it can be an important part of your fitness goals. Hello and welcome to Aging Insights. I'm Dr. Cathy Rowe, Executive Director of New Jersey Advocates for Aging Well. And I'd like to welcome our guest, Joe Goldin, who appeared on our last episode about gift ideas for the older adults in your life. Joe had so many good points and good ideas, we decided to have her back to talk about fitness and specifically about how physical therapy can help you achieve your health goals. So Joe, welcome and thank you for joining us. Can you tell us a little bit about yourself and your experience?
Yes, my name's Joe Goldin and I am a physical therapist. I've been a physical therapist for 38 years. I originally did my training in the UK and then moved to the US. I have worked in many different settings, from the older adult to the professional athlete and everything in between.
Great. And now, can you tell us a little bit about physical therapy, what it is, what it isn't, and what's the goal of physical therapy and how it's different from other just exercising or other therapies for older adults?
Yeah, so the goal of physical therapy is always, with every patient that we see, to maximize your mobility, your strength, your function, and decrease pain. Now, physical therapists traditionally work in many different settings. I have colleagues that work in the pediatric setting with children. We have people that work in neurological settings with people who've had strokes. Anything from athletes, from high school to professional, outpatient PT practices where you might go with your bad back or a bad neck or a bad shoulder, all of those different settings. But the common theme is that every time we see a new patient as a physical therapist, we will do a very thorough evaluation. So first we'll sit down and we'll learn about the history of your problem. We'll talk about all the different things that relate to that problem. Right. And we'll also talk about your goals for what you would like out of treatment. So we'll do that whole sort of what we call the subjective evaluation. Then we'll dive down into what is actually wrong, whether that's your knee or your shoulder or your hip. Now, the question you asked about, is stretching or other therapies, are they part of physical therapy? If you think of any physical therapist having a toolbox of all the different things they could do with a patient, then stretching is just one part of that toolbox. Strengthening exercise is another thing. We have modalities and machines that we can put on. So every physical therapist has a toolbox with all kinds of different things that they can do as part of their treatment.
Okay, great. Now, physical therapy is used after an injury as part of somebody's recovery, but it can also be used for prevention, to prevent illness, injury, or fall. Can you tell us a little bit about that?
Yeah, that's a very good question, because traditionally everybody thinks of physical therapy as, you've had an accident, you've broken your leg, you go to physical therapy.
That's been me.
Right. Or you've had a knee replacement and you go to physical therapist. Most people learn to hate their physical therapist during that process. But as from a prevention standpoint, physical therapists, we love prevention, because if I can prevent some of these things happening, it makes everybody's lives better. So absolutely, physical therapy can be a large part of prevention of further injuries. So it's very important.
Okay. Now, what are some of the causes of the aches and pains people feel as we age? Why? What are they about?
Yeah, so unfortunately, the aging process doesn't really spare many parts of the body. So it doesn't spare your joints and your muscles and everything else that's involved with that. So, traditionally, we talk about those aches and pains are described as arthritis, which is a very global term. It literally means joint inflammation.
Okay.
In the older adult, we're looking at more degenerative arthritis or osteoarthritis. And this is something that it comes on not always in proportion to what you might have done in your youth. So, people who might have played professional football may or may not have as much arthritis as someone who doesn't. So there's really often no rhyme or reason. One of the things I often caution patients on is a lot of my patients come in and they've had x-rays or MRIs that show things, but we as physical therapists and good doctors as well always evaluate the patient in front of us, not the x-ray or not the MRI. Because sometimes people can bring in an x-ray of their knee that looks horrendous from an x-ray standpoint, but they're really doing very well.
Okay.
Conversely, you have someone whose x-ray looks quite good, but actually has a lot of limitations. So we're going to treat, as physical therapists, the person in front of us and not necessarily the X-ray or the MRI. So if you use the kind of knee example, arthritis in the knee, what does that look like? Well, usually some swelling, loss of motion, stiffness of your knee. You're going to lose strength in the muscles around the knee. You might lose some balance and some other function. So as a physical therapist, we can obviously address all of those aches and pains that kind of come on with the aging process.
Okay, that's great. Now, Medicare Part B covers medically necessary outpatient physical therapy, and we want to encourage people to learn more about this and explore their benefits. So how does somebody get started? What doctor do you talk to, and what do you ask about? How do you start that conversation?
Yes, I mean, the best way to make sure that everything goes to plan is to go and see your primary care physician first. It can also be your orthopedist if you are seeing one. So a physician referral is a very good way to start. When the physical therapist first does the evaluation, like we've talked about, they're going to write up a large report on you with goals and plans of treatment. That will get sent to the doctor for them to sign off on.
Okay.
And then as your plan of care progresses, the physical therapist will send progress reports back to the doctor so they know how you are doing. So take-home message, go see your primary care physician or doctor, and then go into physical therapy. And I just want to say that all physical therapists know what these forms are. They're all very averse in all the different forms that are needed for a Medicare standpoint.
Okay. We want to show that Medicare now has an app where you can look up what is covered under Medicare. You can look up physical therapy, what your cost share is, and what you need to do to get it approved. So now I've talked to my doctor, and what do I look for when I'm choosing a physical therapist?
Yeah, that's actually a very good question. So all physical therapists should be able to assess these issues that you see in the older adult. We all learn all of this during school and on into our practice. Now, I think one of the best ways sometimes to find a physical therapist is by word of mouth. I actually have my own physical therapy practice, and our biggest referral source was word of mouth. Because you ask your friends, where did you go for physical therapy? Who was your physical therapist? And, did you like them? So that's a very good way to start the ball rolling. Secondly, often the doctor may have a physical therapist that they would recommend.
Okay.
So you really don't necessarily need to look for a specialized physical therapy clinic for a lot of these issues. Having said that, if you find a clinic and then you call up and want to make an appointment and you have a specific problem, like let's say you feel like you need some help with your balance, it's sometimes good to ask, is there somebody who specializes in balance work at this clinic or specializes in the shoulder? And that's often a good way to get to see the absolute right provider.
Okay. And then we have that old expression, use it or lose it. Can you tell us, what does that really mean and what's that about?
Yeah, unfortunately that expression is true. And the easiest example of this is, if you've been doing a sort of exercise program or something, and then you go off on vacation for 2 weeks and you eat and drink too much on vacation, and you come back and you're like, oh my gosh, I've slipped back so far. It's always challenging to get to a level, and it seems so easy to drop off, right?
Yes.
And to lose it. So the importance of this in the older adult is that you stay as mobile as possible at all times.
All right.
The other thing that's really important, if you feel you are losing it from the physical standpoint, then you need to do something about it sooner rather than later. So, simplest example, if you suddenly realize you cannot reach to the second shelf of the cabinet, then you start thinking, is there a limitation in my shoulder? We as physical therapists would much rather you came in when you've got a slight limitation, or I have patients that come in who can't lift their arm at all. Well, it would have been great if they'd come in a little bit sooner than that. So if you feel like you're losing it, do something about it sooner rather than later is the take-home message.
Okay, and monitor yourself and your changes.
Absolutely. Absolutely.
So in our last Aging Insights episode, the gift guide, we had started talking about shoes, and that's why we decided to have a whole episode about physical therapy. And you said to look at shoes. So I went and I looked at my shoe. So tell me what's wrong here.
So this is actually a very good point, because I don't know how many patients that I have rehabbed, and then at the final visit, let's say, they come in wearing the shoes that they're going to be doing their activities in, and I realize, oh my goodness, they have not renewed these shoes in 20 years. So it's really important. A good shoe can make a massive difference on your function and your risk of falling, for example, and even some of the aches and pains in your bodies. A good shoe will help your knee and your hip and your back. So one of the first things we look at is the heel of the shoe. Now, if you put that heel on the ground, it should be flat on the ground. If we look at a lot of our shoes, we're going to see that it's going to be worn on one side more than the other. Right. Now, it's normal to wear your shoes on one side more than the other. But if that gets an excessive amount, obviously that's going to tip your foot into not a good position and give you much more chance of twisting an ankle or being less stable on your feet. So the thing I always look at is the heel, and is it worn on one side? And sometimes the shoes you can get, you're going to see a massive difference from one side to another. So that's the first thing we look at. The next thing is, shoes stretch over time. So that supportive shoe, when you first bought it, is not going to be the same 10 years later. Okay. So having a good support in the front of the shoe, around the foot, and then also around the ankle is also very important. So the question also people ask me is, well, how often should I check my shoes? Now, that really depends on how much activity you're doing. If you're running 10 miles a day, obviously that needs to be more frequently than if you're walking twice a week. But, on average, I would say 6 months or so, just take another good look at your shoe. And it's something that it's always important to bring into your physical therapist to show them your shoes. Right. And then they can say, oh, these are good, or these are not so good. So, yes.
I did go and get new sneakers after this.
Ah, very good.
So as people are making their New Year's resolutions and they're going to get fit, can you give us some other fun and interesting ideas and ways people can exercise?
Yeah, so one thing I haven't mentioned is exercising in water. And, whether that's a formal physical therapy program in what we call a hydrotherapy or aquatherapy pool, or whether that's at your local community center or gym where they may have a pool. But getting into the water, and it's not swimming, we're talking about, walking in the water or doing some arm exercises in the water, because water has a lot of properties. It has buoyancy, so it actually offloads your body. So that knee that may be sore walking on land won't feel the same in the water, will actually feel a lot better. Right. And it also can assist in some range of motion because it actually floats your arms up to the surface.
Oh, really?
So getting into the water, if that's something you have any sort of desire to do, is really a great way to also exercise.
And we hear a lot about bone health and how that's important for older adults. Why is it so important and what does it mean?
Yeah, so bone health is absolutely vital to older adults. And as we age, especially in the older female population, we do see decline in our bone health. Now, obviously, if your bones are not as strong and you should have an accident or trip and fall, your chances of sustaining a fracture or a break in the bone is much higher if your bone density is not great. So we encourage people to increase their bone density. Obviously, you need to see your physician if this is a real problem, but increase their bone density by the lower legs. The legs you can do by walking, because any kind of what we call weight-bearing exercises is very important for the legs. But when it comes to the arms, the best way to do that is really by doing resistance exercises. So we're going to show that a little bit later with some of the exercises, but don't forget to exercise your arms as much as you exercise your legs, because the most common fracture, aside from the fracture of the hip, would be the fracture of the wrist in an older female.
Well, as you break your fall on the way down.
Absolutely, absolutely. So stronger bones lead to less injuries, which leads to a much better quality of life.
And Joe, I'm going to ask you what we're asking all of our guests. What are you doing personally to make sure that you age well?
So I love to play tennis. So I spend a lot of time on the tennis court hitting tennis balls. That's my thing. I also love to walk the dog. And if I can't go outside and walk the dog, then I'll walk on my treadmill. So
good for
tennis
you.
and walking.
Good. So we want to bring in some volunteers from the Piscataway Senior Center so you can show us how to use some of the physical therapy equipment and how people can start doing this at home.
Yes.
So we'd like to welcome our first volunteers from the Piscataway Senior Center. We have Cara Guttentag and Adita Arsenal here with us. And Joe, show us your magic.
So what I'm going to talk about is just a few things that you can actually do at home from an exercise standpoint. But I just want to caution by saying that you really need to do these exercises under the guidance of your medical professional or your physical therapist. These are just some examples of things that you can do. So if we start over here, what I wanted to show you was a lot of people end up with some stiffness in their shoulder, or, we talked about that on the earlier segment. Suddenly you find you can't reach something in the cabinet. Make sure that you're keeping mobility of your shoulder. So this is a very simple exercise. You can use a broom or any kind of stick you have, and you're going to take that up, all the way up above your head as far as you can. So stretch up as far as you can, arms straight, and back as well as far as you can. Good. And then come down again. Now, the nice thing is that usually we just have one bad shoulder. So let's say she's struggling with her right shoulder, her left arm can actually assist in bringing that broom up. So bring that broom up. Oh, that's a perfect enactment of a stiff shoulder. Well done. So there you go. So you're going to, now when you're looking for stretching, and come back down again, you're also going to take it just to where you feel like it's a little bit stiff. If you just kind of flap it up and down in here, that's probably not going to do anything. So take it all the way up and really push that a little bit just at the end, back above your head. That is beautiful. She has beautiful shoulder range there. And come down again. Yes, very good. Now, the next question is, how many times would you do this? I mean, more stretching is better done less reps and more often. So several times a day, you can get out your broom, sitting in your chair. Let's do it one more time. Show us how beautiful your shoulder range is, and take it all the way up. Beautiful. Simple, super simple exercise to do at home. You can use a cane, you can use a broom, all of those things. Now, over here we have an example of how you can exercise your legs at home too. So sitting in the comfort of your armchair, show us how you can just turn your legs. That's perfect. So it's like riding a bike, but it's really good exercise for the knees and the foot and the hips. So again, you can buy these nice machines that are very easy to use at home. You can change the tension, so you can make it easier or harder, however you want to do it. So that's something that you can do. And again, how long do you do this for? Well, again, it depends a little bit on how you're feeling your knees are. But several minutes at a time, have a rest, do it again later. So you can also do it, during the commercials, during your TV show, or something that will prompt you to do that.
Thank you, ladies. And now we'd like to welcome our next volunteers, Joyce and Artis. Before we show more tools for at home, Joe, can you tell us, where can you find these items that we're talking about?
Yes, I mean, all the things that we're talking about here are going to be easy to find in your sort of large retail store, in a sporting goods store. Some of those discounted stores that I love so much, like Marshall's and things, they have a lot of nice fitness equipment too.
Great. So let's start with Joyce, and we're going to show her some arm and wrist exercises.
Yeah, so the reason I wanted to show some arm exercises here is because osteoporosis, which is really weakening of the bones or thinning of the bones, is a real problem, especially in the older female. And so a lot of people do a lot of walking, and that's very good for the legs and the bone health in the legs. But it's also really important that you do resisted exercises in the arms to help with the bone health as well. So right here we have a 3-pound dumbbell. Again, that's going to be dependent on your strength as to what dumbbell you're going to use. And you can do lots of different exercises. So we can have you take that up above your head. So take that and take your shoulder right up in the air. Perfect. And come back down again. Now she has very nice strength to be able to do that. Let me see that again. Go all the way up. Perfect. So being able to lift things above your head is very important as well. The next thing she can do is use it on an elbow. So you're going to bend your elbow with the weight. Perfect. And straighten your elbow. Again, using your elbow muscles, you can keep going there. You're going to get a little workout on this as well. So using your elbow muscles is also very important. The next thing we really want to strengthen as well is the wrist. So I'm going to have you do a wrist curl with that. So I'm going to come around and show you here. Yep. So you're going to take this and you're just going to let that go down and then curl that up again. And you can keep going there. One of the things that's also people lose the ability to do is grip things. And having good wrist strength is really important in being able to grip things. So you want to be able to come this way with the weight, and then we're going to turn the arm over and lift the wrist up. Good. How does that feel?
Feels great.
Feels good. Yeah, she's doing very, very well. So just to recap, you can go above your head with that weight. So, yep, all the way up. You can also do it with 2 weights if you have them. Come back down again. You can do elbow exercises, so elbow flexion and extension in different planes. That's perfect. And then you can also do the wrist as well. Perfect. Now, if I come over to here, we're also, not only can we use weights, we can also use bands. So bands come in different colors and different strengths. So the different color of a band really denotes the strength. So make sure when you're looking for bands that you're not getting something that you really can't maneuver at all. So, you know, maybe get a slightly more stretchy band to start with.
And these are the, sorry, Joe, these are the bands that physical therapist has in their place.
Absolutely, yes. So if you've been to physical therapy, these bands look very familiar.
Yeah.
Because almost all physical therapists are going to give you some sort of band at some point. So she's done a nice job by securing the band under her foot, and then she can do different exercises. So she can do an elbow, that's perfect. So you can use this as a resistance tool as well, and then you can also do the wrist exercises that we talked about as well. So the nice thing about, yes, resting it, this is a good point, resting it on the chair, and this was a question that I get asked frequently, is good because it isolates the movement to the wrist rather than lifting the whole arm. So that's an excellent exercise, and you can see how beautifully she's using all those muscles right there. So that is excellent. Now, one of the other things that becomes a difficulty in the older population sometimes is the ability to use the hands and hand strength. Opening things, you know, gripping things, that can be a real problem. So one of the best tools for this is this putty that we have. Now, I'm going to give you the putty now to play with. So each of you has a putty. Now, this putty is, it's super fun to play with. You know, it's really, it's one of these sort of stress relieving things at the same time. Now, the beautiful thing about this putty is it comes in different resistance. So you need to, because some of the really strong putties, you can barely grip them. So make sure if you're going to purchase this, that you get putty that has a variety of different resistances. This is the extra soft, so you can do all kinds of things with it. That one's a little bit harder. Now, one of the things I always say with putty, if I'm just going to demonstrate that for a second, obviously you can do gripping things, that's really important. The other thing that people tend to lose is different grips. So do it with different fingers. So make sure you're using it, yes, you can do either hand. So use it with different fingers, very good.
Oh, wow.
Yeah, because that, you know, sometimes that pincer grip has gone, you know. The other thing that tends to get lost is the ability to unscrew things. And sometimes the easiest way to do this is to take a towel, a rolled up towel, and actually do resisted exercises with the towel. I'm going to give this to you. I'll take your putty and your dumbbells. You've done an excellent job there. And put your hands on that, and then as if you're going to wring out that towel. Okay, so you're going to wring it out. That's it, good. And so this is a very good exercise. You think how much activity you get in the hands and the wrist when you're actually doing that. And you know, we've lost that function sometimes to be able to grip in that way. So all of those things are very useful. But this putty is especially designed, yes, perfect. I have the most perfect patients here. So perfectly designed to be able to do different activities with the putty and also use the towel to be able to wring things out and do different things at home.
And how does that feel, ladies?
I didn't feel the muscles moving.
That's good. Yeah, it looks sort of simple, but actually it's a decent workout, this putty. Right? And this, right? Yeah. And you're using both hands in all kinds of different ranges there with some resistance. So those are super simple things to use at home. And obviously all of these are going to help protect the bones of the arms, which are somewhat prone to fracture if we have a fall, if there's an osteoporosis situation. So everybody strengthens their legs with walking, but let's do some arm exercises to get those arms really strong.
Good point.
So one of the other things that you see this a lot on the market now is these different tools to massage yourself. You know, some people have these sort of Theragun type things, but you know, sometimes as simple a thing as this that has a little bit of friction on it that you can roll up and down, you can lie on it, you can put on your legs. These are actually very useful tools as well. Here, I'll let you have a little play with that. You know, some of the other, just be careful that it's not too aggressive on your muscles, any of the different sort of massaging tools. So you have to be a little bit careful. But, you know, there's lots of different things on the market that you can use to actually work out some of those kinks.
That's great. And all of these you can find, like you said, at a retailer, in the fitness aisle, at a fitness store.
Absolutely.
You can find a range of products
or on
like
your,
these.
you know, your local order online
Okay.
place. Absolutely. Yes. Very easy to get all of these. And I tried to use things that are easy to use in the home and you might even have in the house. Your broomsticks and your towels. Yes.
Well, thank you, ladies, for joining us. You've been excellent volunteers. I want to thank the Piscataway Senior Center for sending over 4 of their fittest to join us today. And thanks to you, Joe, for showing us all of this.
Oh, it's been a pleasure.
Good to have you. Thank you for watching this episode of Aging Insights. I want to thank our guests and volunteers for showing us how it's done. To find out more information and to view previous episodes, please visit our website at www.njaaw.org and click on Aging Insights. Aging Insights is brought to you with the support of our funders, supporters, and viewers like you. I want to thank our partners here at PCTV for helping us bring our guests to you. If you need information or resources about services in your area, please contact your County Office on Aging. Their phone number can be found on our website, or you can dial the state hotline at 1-877-222-3737. New Jersey Advocates for Aging Well wants to remind you to stay safe during the pandemic. And so please reach out to older adults who may be isolated, need assistance, or lonely. Thank you, and be sure to tune in next time.